Hello, y'all. This is Dr. Simpson. Dental advice for you. Real quick, a cleaning is not a cleaning is not a cleaning. Everybody expects to get a free cleaning that is covered by your insurance. But let me tell you one thing. If you have a lot of tartar on your teeth, or you have what they call deep gum pockets or bone loss, you not or you shouldn't get a regular cleaning. At that point, you have what they call periodontal disease or gum disease. The old folk used to call it pyorrhea. Now, there's different levels of that, mild, moderate, and severe. And if it's too severe, your teeth gonna start getting loose. It's almost like you put a pole in the ground that's real sturdy and solid, but you start digging up that ground. What's gonna happen? That pole is gonna start getting wobbly and loose. Same thing with gum disease. If you don't floss effectively, go to the dentist, make sure that tartar and plaque that harbors bacteria that causes gum disease is removed, then guess what? A regular cleaning is not going to help. So take my word for it. You may not qualify for a regular cleaning, and don't be mad when the dentist tells you that or the hygienist. Please follow. There's be definitely more videos on this. Go to my YouTube page, subscribe, go to my website, dentaladviceforyou.com. I will be posting more in-depth videos about gum disease. Thank you.